Hello there. Today, One Cancer Place introduces you to a poignant story of a person, one of a series of personal stories that provides a peek into the authentic life of a cancer patient. We hope that you find the magic in these unique stories because each of these lives is lived to the hilt in service for others and in deep gratitude for survival. One Cancer Place, the newest patient-led community, leads the way in delivering the revolution in care to its growing membership of cancer stakeholders and patients. Find and connect with us online at www.onecancerplace.org. Hi, everyone. I am Lindsay, and I am here today with Megan Claire Chase, a.k.a. Warrior Megsie. Hi, Megsie. How are you?
Hello, I am fabulous. How about you?
I'm doing very, very well. Thank you. I'm excited to talk to you. And I'm excited because as we started our conversation, you had so much energy already. And then you told me that there were lots of difficult things in your life going on, but your general sound and attitude seem so positive and vibrant. And obviously, that can't just be a coincidence. So, can you tell me basically right now, what is your general outlook on life and how are you approaching each day?
Woo, that's a pretty heavy question. What I often tell people is, after going through breast cancer, that cancer cannot take away the essence of you. And the essence of me is joyful, zany, nutty, but oftentimes it can be hard to physically feel the joyous way that I can often sound. And so that's why a lot of people never realize, oh, she's in chronic pain. What? Her pain level's at a 10? Yeah, because my pain level sits between a 6 and a 14 every single day. And that's all stemming from all of my cancer treatments and multiple surgeries and now new health issues. But I try and take things just a little bit at a time because I can get very overwhelmed. I do a lot of different things, and I'm really working hard to make myself the priority. A lot of people think, oh, after going through cancer, wouldn't you already make yourself the priority? But no, a lot of times you end up going back into the ways you were before, putting everyone else and everything ahead of you first. And so my outlook on life as of this moment is to just kind of sit with more things. I often feel like I'm not doing enough, and it turns out I'm doing quite a lot. So it's okay to just kind of coast on that a bit until I can figure out whatever that next step is.
Yeah. Yeah. Okay. Take me back to the beginning when you, I guess the days before you got your cancer diagnosis and how you were feeling and what sort of ways you knew maybe I'm not, I need help.
So I always knew that I would get cancer. And that's because my mother had ovarian cancer when she was pregnant with me. She was diagnosed after her third month. And it had already taken my parents 8 years to even get pregnant with all of that. And then I was born 3 months early. So I was born July 3rd, which also happens to be my grandfather's birthday. He would have been 103 on July 3rd if he was still here. And the big kind of joke in the family was that I looked nothing like my mother externally, but internally, I got all the issues. So growing up, being a preemie and already having a lot of health issues, especially, around my ovaries and my cervix. And as I got older, because of that ovarian history, and then my maternal grandmother had cervical cancer, I was just always hyper aware of what was quote unquote normal for my body because my Nana, she was a registered nurse. And she just taught our entire family to always know what is normal for your body and that it's your patient right to get pushy. And that could be hard to get pushy with the doctor. But I had started feeling really strange around 35. And I was able to get a preventative mammogram at that age, all because of the family history of ovarian cancer, since there's a link between that and breast cancer. But they told me, you're fine. Come back when you're 40. And I was like, okay. But throughout that time, and I'm talking about like a 2.5 year period here, I was feeling miserable. I had gained all this weight. And as someone who was always super fit and just physically strong, I mean, I grew up studying ballet. I was a cheerleader. I would dance, I could salsa and swing dance with the best of them. And all of a sudden I had no energy. And as someone who has a lot of natural energy, and I often wear myself out because I'm very dramatic, because I do have a theater background. But I was like, why do I have no energy? That's not common. And then my hair, which used to be straight and very thick and down to my shoulders, it started falling out on the left side. And I'll never forget it, because my stylist had been doing my hair for like 10 years at that point. She was like, are you missing a nutrient? She's like, what's going on? And I said, I have no idea. And then my hair just started falling out, and we had to cut it. I mean, cut it short. I've never had super short hair before. And I was just like, something is wrong. So I kept going to the doctor. And then I would get these tiny green bruises on my lower left leg. And since, again, I'm hyper aware of what's normal for my body, I'm like, this is not normal. Maybe it's leukemia. And they were like, no, you're anemic, but it's not enough for that. I said, well, obviously something is wrong. And so I kept bouncing between my primary care provider and an endocrinologist, because like my nails started getting brittle and weak. And I was just like, what is going on here? And instead, I just kept being told throughout, you just need to lose weight, eat better, and get more sleep. And I'm thinking, okay, the whole point is me gaining weight. Like, that is the problem. And I got really upset, because I felt like I was getting the typical answer that Black women tend to get is, oh, you just need to lose weight. Like, it's all my fault, like totally fat shaming me, when the fact that I was gaining so much weight, like
Was the issue.
a clear issue.
Yeah.
Exactly. But then I got like this, I was told was a zit on the outside of my left breast. And I remember going to the dermatologist, and she told me, she said, yeah, that's a zit. And I'm like, I've never had a zit on the outside of my left breast before. I've never had a zit on my breast anywhere before. And I just didn't feel like I was being heard. But she gave me some cream, and it did go away in 3 days. But that was just like, I was like, that's just not normal. And it didn't hurt or anything, but I just, kind of I put that in the back burner, but I was just like, something's not right. And then I get this circular green bruise on the back of my left arm. So by this point, even my primary is finally like, okay, I don't know what's wrong. I don't know what your body is trying to tell us. Let's make an appointment. I'll see you in 2 weeks. And if it's still there, we'll try and figure out something. I'm like, okay, I've only been telling you for over, 2 years. The way it happened is I was a really big fan of Supergirl, the first season. And so I was like, oh, I got to get ready for Supergirl to come on. I'm going to get, a shower, get my favorite PJs and everything, because I don't know what that particular episode was. And I was just like super excited about it. And when I got in the shower, and because of the weight gain, my breasts had gotten bigger. So I was always feeling them. I was like, dang, I never had big boobs before. But I felt something. And I'm telling you, it like came out of nowhere, because it was not there that morning. And it was hard, and it felt like the size of a fist. And I was like, but it was on the side of my breast, like almost near my underarm. I'm like, what the heck is that? But again, I still didn't even think breast cancer at all.
Hmm. Interesting. Because was it that you were expecting to get ovarian cancer?
Yes. I had been, that's where all of my issues were. I was having cysts the size of lemons on my ovaries.
Wow.
And they were thinking that I probably had some endometriosis, because I had very painful periods, like to the point like debilitating, and then I had a couple of abnormal pap smears. So the fact that I had been told, hey, you're clear with your preventive mammogram. Come back when you're 40. No one else gave it another thought. I didn't even think that the thickening, because it was not a lump. I mean, I already knew it was a mass. And that's because I also just know a lot medically, because my mother also has a rare blood cancer now and also at that time. So I'm just hyper aware of a lot of medical terminology. And so I just knew it was a mass. So again, I was not surprised when I was told to get a biopsy. And I'm like, well, I could have told you that. Like, this isn't a lump. But because of where it was located, I just didn't think breast, or maybe I didn't want to allow my mind to think that. But it makes me also hyper aware of how much this whole breast cancer awareness, Pinktober, all of that crap really does not educate you. Because everyone knows about breast cancer, but we're not educated about it. And so,
Wow, that's an excellent, excellent point. You were having so many issues and they just weren't surrounded by the things that everybody's always, that all you know is to like check for, hard lumps. And that wasn't really what happened for you. How did you eventually find out what it was? And once you knew, did you at least get some kind of comfort in knowing I was right and now I can actively go about fixing this?
yeah. So it was during the biopsy is when I realized, wait, something might really be wrong. The doctor, and I don't know if you watch if you watch Grey's Anatomy, but her name was Dr. Gray, and I thought that was hilarious. She did look like she was 12, but she assured me she was not 12. She told me that she was going to take about 8 to 10 tissue samples, and I was like, all right. But then when we got in there and I'm counting, and she took, almost 20. And I was like, okay, she must see something. But again, in my head, I guess I just was like, I don't know what it could be. Maybe she'll figure it out. And I happened to get that biopsy. It was on a Friday, and it happened to fall on 9/11/2015. And so I wanted it as late in the day as possible, because then I just want to go home. I didn't want to have to go back to work. And so because it was so late in the day, she was like, yeah, you'll probably get the results, Tuesday or Wednesday of that next week. I was like, okay, cool. So I'm at work that Monday. I'm in my cubicle. At the time I was working on the radio sales side in media, and I'm always aware at the time. And I had just like timed a commercial, and I was just like annoyed. It's the afternoon. I'm like, oh, this commercial is way too long. Like, didn't I tell them it's only 30 seconds? And then my phone rang, and it was 3:05 p.m. And that is a time that I will never, ever forget. And I almost didn't even answer it because, now we're like, someone calls, like, who is that? They're going to get a voicemail. I don't know who that person is. But my gut was like, I think you should take this call. And I did. And the doctor, she tells me, she's like, Megan Claire, you have invasive lobular breast cancer. And like, I was like, I have what, a what? What? And then I started to get hysterical. I was not in my cubicle at that time, thank God. I had enough sense to go to an empty conference room. But I started to get hysterical because I'd never heard invasive lobular. And again, I just get really upset about this whole breast cancer awareness, because like, how many people know that lobular is a subtype of breast cancer? They don't.
What does that actually mean?
Yeah, right? I was like, what is it? It turns out that lobular is known as the sneaky cancer. So the most common type of breast cancer that 90% of women get is ductal. It's in the ducts, and lobulars in the lobes. And it's actually really hard to detect. It's often missed on mammograms. So I know for sure it was missed back when I had it, a mammogram at 35, because it can mask and look like healthy tissue. And so it's just really hard to detect. And it's often comes in the form of like a thickening of a mass on the side of the breast. It's also rare in Black women. And at that time, when I was diagnosed with it in 2015, 2016, there wasn't a lot of information about lobular as a whole, let alone lobular in Black women. So because I immediately started doing my research after, I got over the shock. And like you said, Lindsay, I felt validated because I had known all that time something was not right. And I kept pushing and pushing. So at least I know I was doing everything right because I knew something was wrong. It's my doctors who did not believe me.
Wow. That's wild. And I would love to hear you more talk about more your experience as a Black woman. And if I'm correct, you're in the South as well, right?
I am literally about 15 minutes away from Atlanta, Georgia. I live in a suburb called Dunwoody, Georgia. So yes, and I grew up in Macon, Georgia. So yeah, being a Southerner and being Black
And being a
definitely
woman.
does affect your access to care.
Tell me, throughout your experience with the medical system, like growing up knowing how your mother had to deal with the system, how did that affect how you saw yourself dealing with it? And what advice would you give to other Black women who are needing to be the primary fighter for themselves because the system itself isn't going to help you as much?
Well, I feel like it was different for my mother because I was born in Iowa, of all places. That's where my father's from. Yeah, I was born in Iowa. And she just happened to have gotten like really great treatment. She was on an experimental drug, which we feel ultimately is what saved both of our lives. So she had great care. But then, we fast forward it to me. And, though I was always going to the doctor as a little kid, I never really thought much about it. But then as I started to get older, I realized that, wow, sometimes I do really need to speak up. And it can be hard because even the most vocal person can have a hard time speaking up in the moment when you're with a doctor who is condescending or the doctor who is not believing what you're saying and grouping you in a bucket of, not seeing me or others as individuals. That's a problem. They're not checking their own biases. And I really started to experience that throughout that like 2 to 2.5 year period of knowing something was wrong, but getting the typical, oh, you just need to eat better and, make sure you're not pre-diabetic and saying all these things to me instead of actually listening and saying something is odd because why is all of this happening on your left side? One of my big platforms as an advocate is I say, you need to tell your doctors that as a Black person, however you identify, your race is Black and whatever your gender, however you identify, is our symptoms can often present differently than our white counterparts because my body was saying over and over again, something is wrong on the left side. And it let me know with all the bruising, only on the left side, my hair falling out, only on the left side, that weird zit on the left breast, like all of these things. And then when I even said, you know what, that's what my body was trying to tell us. Oh, we don't know if that's what your body was trying to say. I'm just like, okay.
Yeah, obviously you didn't know, but I knew.
Right. Like, and so that's something I consistently say. And it can be hard to speak up in the moment because especially if you're by yourself and you're hearing a lot of different information, there are other ways to advocate for yourself though. So it's like, if you can't speak up in the moment, that's okay. Like, don't feel bad about that. Like sometimes you need time to think about what you just heard. And, and sometimes I know I've like questioned myself. Was I being too sensitive? And then I'm like, no, I wasn't being too sensitive. That was downright condescending and I don't appreciate it. And so then I would like write something in my portal because I wanted it to be like notated in my medical history of this issue that I was having or how I didn't feel like I was heard and how, I want to get a second opinion and all of that.
Yeah. Amazing. Okay. So at this point, where are you in your cancer journey? And also, How did you find One Cancer Place, and how has that been a part of your journey?
Yeah, so now I am almost at 7 years. I go to my breast cancer surgeon for my scans every 6 months, and I will continue to do that for a full 10 years because I was diagnosed under 40. And I kept hearing the term AYA, and I was like, what's an AYA? And I was a young adult. I just thought that was so odd to keep being called a young adult throughout my cancer treatments and surgeries. But then I started to discover that's a really underrepresented category. And why are so many people getting cancer under 40? And to think that if my mother hadn't had ovarian cancer, I wouldn't have been able to get a preventative mammogram that would be covered 100% because anyone can get a mammogram at any time, but it won't be covered, unless now they just lowered the guidelines to 40. But I'm like, that's still too old, because a lot of us are getting diagnosed under 40. And I think that's a big problem. And so my connection to one place is I met the founder, Erica, last year at ASCO in Chicago. And I remember we met in the patient advocacy lounge and we just started talking. And she was telling me of her idea of having just a central place to connect other cancer patients and survivors with different types of cancers because there's a lot of shared experiences, even if you didn't have the same type of cancer or even same subtype of a cancer. And so I really love that idea of being able to talk with others, because sometimes it can get a little too pink for me. And I want to talk with others who have different cancers. So I just like having a space where we can all come share ideas. If we're writers, like I'm a writer, sharing articles and information. And I like how every post is celebrated, amplified. So that's really how my connection.
One Cancer Place, yeah. Well, speaking of being a writer and having articles shared and amplified, can you tell me about being in the New York Times during the onset of COVID? How did this happen, and what were you talking about in that piece?
Oh my gosh, right. Like that was so amazing. Like if you would have told me, A, that we'd be in a pandemic, and then B, that I would be in the New York Times, I would laugh. What happened is it was at the height of the pandemic. Like things were starting to shut down. I had just gotten laid off, but because I get my scans every 6 months, we make those appointments like, 6 months ahead of time. And so all of a sudden I was like, oh my God, I'm going to lose my insurance. I've got to move up my scans because as of like that next week, I would not have health insurance. And so I'm calling the doctor's office and not realizing on their side, they were furloughing a lot of staff because obviously they're not going to tell that to patients. So they were trying to schedule, push appointments further out. And I'm like, I can't have it pushed out. I've got to have it, by this date. And it was a very stressful time and situation because I was like, I can't go into a pandemic knowing if I'm half in a relationship with Ned, no evidence of disease. That's how I like to refer to Ned. And they told me, hey, we're only able to get you the MRI and we can't get the diagnostic mammogram. And I was like, oh my God, what do you mean? And a friend of a friend is friends with the New York Times reporter. And the New York Times at that moment, that was like March, April 2020, was talking with people around the country to see, how they were affected, like who was really impacted by COVID. And in the cancer world, many of us were, because if we got laid off and the fact that our health insurance is tied to our employment, that's really hard because we have to always make sure that all of our physicians and medical team are covered under the insurance. And I was freaking out. I was so stressed out. And so that friend of the reporters was calling her other friends, and it happened to be a friend of mine who reached out to me and said, hey, the New York Times is looking for stories of people being impacted by COVID. I immediately thought of you because I'm very open with my cancer story, but I was never open about it professionally. Like I never talked about it on LinkedIn or anything. So she gives me the information. I still have the email too because I put it in my scrapbook because I just couldn't believe it. I was like, this is a real New York Times reporter. Oh my gosh. So we had the interview over the phone. And then they sent a photographer to me here in Atlanta, which was great. And because of COVID, they had actually closed a lot of the parks, which was so crazy. So we had a really hard time finding a place to, do the little photo shoot. But that article for me was a really pivotal point because it was the first time I talked about cancer and my profession in the same sentence. And I had never done that before because we're often told, don't let your employers know that you have cancer. Don't say anything. And there's this pressure of that you have to be quiet. And I was just like, I can't be quiet. I cannot choose between my health and my career. Like they're one and the same. Because if I don't have my health, how can I have a career? And so that's really what the article talked about is how frustrating that is and how scary it is to have your health insurance tied with your employment. And so, of course, I did end up getting, some Obamacare in between that time, but that even took like another few weeks. It's like I had medications, so it's people don't think how much you need your insurance until you get a critical illness.
It seems like you shouldn't be able to lose insurance after you've been diagnosed with a life-threatening and physically debilitating illness. That's so hard.
I agree. And I often feel too that with insurance, those who are able to enter into the quote unquote survivorship stage, I feel very strongly about this. I feel like, okay, if you've had a cancer diagnosis and you have now made it to the survivorship stage, well, that also opens your body up to other illnesses and things that you never would have experienced if it had not been, for your cancer. And so the fact that many of us, including myself, have had to fight with insurance to get tests covered, to get procedures covered because they'll deny it saying, yeah, you're not old enough for this. Or I'd heard that a lot. You're too young to have this procedure, or we don't understand why this is medically necessary. And it's just like, okay, if our doctor is recommending this and we've already been through cancer, I feel like that already should push us to the front of the line to say, yes, whatever your doctor is wanting you to have, you will get it.
Yeah. Wow. I think it's so interesting that you have sort of a collection of unique relationships to cancer. You have a mother who has a relationship with cancer. You yourself have a relationship with cancer, and you are a woman, a Black woman in a country where access to care is not easy for the most privileged of people, but less so for anyone who is not the most privileged. What do you hope to see change in the coming years for people who are currently on their cancer journey and for medical professionals who take care of these people?
I would say, first, trust your gut, because it has to start with you. If you know that something is feeling out of whack or, something is just not feeling right, trust your gut, because a lot of times your body will talk to you in many different ways. It's just you have to really pay attention and listen to it. And then once you realize, okay, this is not my imagination, go to the doctor. It really is so important. And I don't like to say people find their voices, right? Everyone has a voice. Some just need a little help in amplifying it or figuring out how to use it. That's what I like to say. So it's like, okay, if you have these issues, and the doctor keeps coming back to you saying, well, that's not common or that's not this, say, okay, it may not be common, but this is what is happening. Like you really do have to push and truly advocate in different ways for yourself. And it can feel uncomfortable. Sometimes you may feel like, that you are being pushy. And I also know too, for me, I still dress up to go to the doctor. I have to watch my tone because I don't want to come across as an angry Black woman, because here, at least in the South, it is really hard to find providers of color, especially specialists. And once you go through cancer, you're going to need a lot of different specialists because so many of us have different health issues now. What's been one of the toughest things is having my pain believed. And I really wish the medical community would understand that Black skin and Black people, like the Black skin is not thicker. So don't use bigger needles when it's not necessary. I've actually had that happen. And it's only because I'm just such an informed patient from my Nana over the years that I know what size needle should be used for certain things. I'm just like, why are you using this bigger needle? How many other people would know that though? And the fact that there's still this belief that Black people don't feel pain as much. And I'm just like, where did that come from? And I can't believe that's still being taught. But also too, take pictures, because like with my bruising, I did take pictures of that, except for that circular one on the back of my left arm. So it's really hard to get to. But like take pictures, because unfortunately, if you are Black or another person of color, you're going to be questioned. And a lot of times by the time you get to the doctor, whatever rash, whatever that was there sometimes might be gone. And then they'll be like, oh, it was all your imagination. I've actually had that happen. So I really just hope that the medical community will start to recognize that, yes, we need all of the things, all of the attention when we get diagnosed, we're going through active treatment, but please don't forget about those in the survivorship stage or those who are stage 4, because there's like another level of care that we need. And it's expensive to get a cancer diagnosis. I don't care if you're the wealthiest person in the world, it is expensive. And the fact is, even though I've survived it and I'm still getting scans and there is a 30% risk of recurrence, I have these other health issues now. And there are no grants to help those who are in the survivorship stage who now have health issues all stemming from their original cancer diagnosis. And so there's no funding. And the fact that many of us are living longer, like we need some help.
Yeah. Wow. Well, I guess as we close out, especially for those people who are in the survivorship phase of their journey and those people who are able to connect with other survivors through places like One Cancer Place and other groups like that, what would you say to them as they move forward in their journey, and how has connecting with other people helped you?
You really need your cancer peeps. You really do. Because there's going to come a point when, if you are able to enter that survivorship stage, and I'm very sensitive to my stage 4 friends, because too many of them, the cancer has taken them away. And I know too many who have stage 4 right now. But for those in the survivorship stage, it can be hard to talk with your friends and family who are outside of cancer land, because you're thinking, what? You're over 5 years out? What? You're 10 years out and you're still talking about your cancer? They don't understand the PTSD that comes with it, the anxiety when you've got a scan coming up. They don't understand that trauma that has happened and how you feel betrayed by your body. And that's why it's so needed to find connections within the cancer community. And I'd like to say too that not just within the type of cancer that you had either. Like I have cancer friends who had many different types of cancers, because again, it's those shared experiences. And also the connections are so deep so quickly. Like I can talk about the things that might be really embarrassing to say to a family member or a friend outside of cancer land, but inside of cancer land, they're like, yep, I've had that constipation too. And yep, I've had that too. And like you can just kind of release and talk about some of the darkness that many of us have felt, because I mean, depression definitely comes with this and anxiety and the fear, and sometimes even the fear of living, so to speak, and how difficult and challenging it can be if you are someone that now has chronic pain and how that impacts your life and how many of us have had to change careers. And so it's just so important to find those connections. But I do recognize there's another element that many don't talk about is when you make some of these connections, there is that risk that some of your friends may die. And no one really prepares you for that. I still remember the very first person who I ever knew who died from their cancer. She was only 32. She was here in Atlanta. And ever since that moment, I recognize and I cherish every friendship. And if anything, I always feel that I'm so much happier that I had a chance to get to know them for the time that we had.
That's beautiful. Well, Megsie, I've enjoyed talking to you so much. Is there anything that you want to just say quickly to everyone who might be listening, friends who might have someone going through a difficult time, a person who might not have someone that they feel comfortable talking to about the challenges with their career or with their family?
I would say, you're not crazy. You're not being too sensitive. But it's hard. It's hard, and everyone deals with things differently. And so, what I say is, don't be afraid to get professional help. I have a therapist. I nickname him. He would die if he knew that I call him the cutie therapist. That's how I always talk about him. But sometimes it can be hard to find the right therapist, and that's okay. But recognize that some of this, cancer is big. So you're going to need some help processing it. A lot of things you might end up repressing because you have to just like get through the treatments, and it might come up like years later. So don't be afraid to ask for help. Don't be afraid or be upset if you may need what I like to call a buffer, which is an antidepressant. Like that does not make you weak. If anything, that makes you a stronger person because you're recognizing that you do need some help and that it's okay